Good morning, everyone. Thank you for Pusen giving me this chance to participate in the first launch of the smallest scope in the world, 7.5 from Pusen. I mean, we're talking about disposable. Have my declaration that you work with these companies. All videos and images are consented. As we all know that the flexibility scope divided in two types, where we have the disposable and reusable. The reusable were having a big history of conventional and digital is more superior in this vision, while the conventional was superior in the size. So most of the interested points for any company to deal with the vision and the size. You could see here that the conventional could go to 7.5, as you know, Flex X2 from stores. And most of these companies are trying to improve the vision as well as the size. If you go and see the latest generation of Olympus, the conventional wing P7 is about 7.9 French in the shaft, while the tip is 5 French. With this gives you an idea about how small are these scope, like a double G stent 8 French. Flex XC is the most common and famous digital scope in the markets. We have this shaft of 8.4. Even some companies, they competed in disposable region to be among the 8.4, 8.6 French. Wolf, from their size, shifted from 9.9 to the digital or the conventional 8.8 or 8.7, where you can use an access sheet 9.5 or 11.5, which is the smallest access sheet in the market, keeping the two things of working channel 3.6, sorry, and the deflection upside down 275 or 270 in some companies. What strikes me in the Pusen 7.5, the new one, we call it slim green, is that they're talking about 7.5 French. I just put this photo to compare it with the semi-rigid from Olympus, where they're talking about 6.4 in the tip and the shaft 7.8, but clearly that this Pusen 7.5 is smaller than that. So what does that mean? Is Olympus is not right about the calculating the true size of their scope, which is not 6.4, or giving the sizes of the Pusen 7.5, or gives you an idea that the Pusen 7.5 is smaller in size than we think, and then Pusen is advertising 7.5. The bottom line here, this scope is very small, very, very small. I think it's ranging between 6 to 7 French in size of the shaft, and the large diameter in the shaft is almost 7 French, keeping the deflection at 275 as well. When it goes to the deflection, because some people will say that more, if you increase in the size, you have more durable, more deflection, which is not true. If you have a large truck, you cannot drive it as easy as small cars. So you could see that Flex XC 8.4, it's slim, it's deflected very nice inside the kidney, which is, this is a polycystic kidney. You can see that the impressive 2 deflection offered by reusable. The first generation or second generation of Pusen 9 French has impressive deflection with a double deflection, as you can see here in the photos. And if we think about Pusen 7.5 in the pediatric group, which is a very small kidney, you cannot imagine a kidney in 18-month-old baby. You could see that how impressive the acute deflection could be done in a small kidney by 7.5 French from Pusen, which gives you an idea that if you get smaller, you have a more space to swim inside these small kidneys, as we are talking about the pediatric urolithiasis. Again, what is the importance of these scopes and deflection? You can treat the lower polar stones you can see here by the Algerian F9 French. How about the small size of the scopes? The pediatric urolithiasis and the treatment in the retrograde intrarenal surgery has been there for the last 25 years, 20 years. Most famous paper was in 2006 in Journal of Urology by the group of Singa and his colleague, where they described treatment stone as large burden as you see, and the age is 4 years to 15 years. They use an access sheet 1214, and their scope, it must be between 8 to 9 French, what gives you an idea that 16 years ago, they were using a large diameter without mentioning the complication or anything. So we are now, for the last 10 years, we are using a smaller scope, such a P5 from Olympus or the P7 from Olympus, which is about 8 French. Even in the big kids, 10 years or 13 years, we can use the 9.2 French with the access sheet 1214. If you want to use an access sheet, there is no problem. However, these are small ureters. If we could use the smallest scope, it will be giving us a more free for success rate and more free to have more access to the kidney and to the virgin ureters. You see, this is a patient, 5 years old, 2 centimeter stone, using a small scope, small size scope, and you could do fragmentation, dusting, and the patient goes home in the same size. How small these scopes? The 8.4 French goes inside the 6 years old girl kidney with a 40 millimeter stone and dust it and turn it to dust using a laser. 13 years old girl, again 2.5 centimeter stone using a good laser, wise irrigation. The access sheet is 1113, endoscope is 8.7. So when you have a smaller scope, you will have a more time for more space between your scope and your access sheet to have more irrigation and more drainage for such a stone in a small kidney, those groups of patient pediatric urolithiasis. Smaller scopes gives you space to treat bilateral renal stone as bilateral uteric and renal stone, as you could see here in this patient, where the size really matters. Bilateral renal stones in a 4 years old is a reality where you treat it using a very, very small instruments. This is a 10 years old boy with a cystine stone, had been through 4 PCNL, 3 flexibility scope, but no success rate. We optioned to have a retrograde. We optioned the family to have a retrograde intrarenal surgeries using a laser on a stage therapy, as you can see, to achieve success rates, as you can see by the video in the right hand. Therefore, the flexibility scope with the size is important. Children to treat these special cases without harming the parenchyma with a multiple puncture or multiple PCNLs. The point here that I wanted to say that regardless the success rate and the retrograde intrarenal surgeries effects on the children, we have some sort of injuries which was described in adults. They have about 46.5%, as Olivier Traxler described by the access sheet 1214. This is an flexible uteroscope, a 9 French in an 11 years old boy, and we are lucky to have such a healing in 4 weeks. But this is a message tells us that this scope of 9 French, most of the disposable ureteroscope are between 9 to 9.5. And this gives you an idea, why don't we go smaller? Why don't we go to 8 French at least? But surprisingly, Pusen came into the market with a 7.5, which is smaller than we think. And we think this is okay. This is a small scope. It will be broken as soon as possible. It will not help us. As you know, all the materials with the size comes down. So the vulnerability of the durability will be down. and it's not true because the deflection was great, as you could see here in these images. Lower pool obstructed 1 centimeter stone, and the UPJ pushed into the lower pool, then or the upper pool, then fragmented, dusted, cleared the patient. We use an access sheet 9.5, 11.5, which is gives you a space of 2 to 3 French for having to decrease the intrarenal pressure. If you don't want to use an access sheet and use this scope, there is no problem. You are putting at least 7 French, the maximum, as explained, comparing to the another instruments. The maximum is 7 French inside these kind of in these ureters in such a group of patients, pediatric urolithiasis. So this is it solves the problem of the access to the kidney. It solves the problem of the irrigation inside the kidney, comparing to the larger sizes of the scopes. The take-home messages from such a scope is that we have to understand that you have to have this concept between the anatomy and your material. You cannot stay with your material in 2010 and work in 2021 with the same sizes of instruments. So you have to go small. You have to think about the size, because it's very important as the vision. In the pediatric group, do not hesitate to pre-stent, because most of the literature showed that the success rate and the success rate increased and the complication decreased if you pre-stent your patient. But I think here with this scope, you might not need to pre-stent your patient, which is a point that we have to study it in the future. Is the 7.5 prove that there is no pre-stenting in the children or not? We don't know yet. We need years to study about these sizes vis-a-vis the ureter size of the pediatric. It's a very low morbid procedure, but you have to know that every French counts in the pediatric group, and you have to go down as small as possible, and that's why Pusen 7.5 gives us the smallest disposable scope in the market now. Even in adult, if you want to use it in adult, but I'm talking about the pediatric group. And this will show us why the size is very important. Thank you very much.